Hi everyone, I'm Dr. Richard Stevenson and I'm the Director of Stevenson Dental Solutions. We're located in San Dimas, California. And we're going to talk about the full glow crown preparation on a mandibular molar. A good prep starts with a nice burr block, and we have a terrific burr block. You can buy these burrs individually or you can get them all assembled in one block. We can perform just about any prep you can imagine, from a gold onlay to an all ceramic crown. We're going to start with the occlusal reduction, and for that we're going to use the 57010. Now a 57 burr is 1 millimeter in diameter, and we're going to use the burr by reducing planes rather than using depth grooves. Now, depth grooves are definitely an accepted technique and is taught in almost every dental school in the world, but so many students and clinicians have difficulty with depth grooves in ending up with a very smooth and refined occlusal surface, because those depth grooves leave lots of little bumps that you have to remove during the smoothing process. So my technique is, why don't we smooth as we go rather than smooth at the end? We're still making a depth plane while we're reducing. We are very carefully making sure we've taken away at least 1 millimeter of tooth structure, and we can measure this very easily by looking at the remaining wall of the unprepared surface and looking at how our burr can fit up inside the preparation. So a depth plane versus a depth groove. And we're going to do all of the reduction in this particular manner. The distal lingual is nearly completed. Now we're going to work on the mesial lingual following exactly the same pattern. We're going to be making a plane and reducing it and measuring how much we're reducing by visualizing the amount of remaining tooth structure that is present at the tip of the burr. We're going to keep the burr angled parallel to the incline as we're doing this, so that we don't make the preparation too steep or too flat. If we were to lay the burr down almost horizontal, we would destroy this preparation and leave those lingual cusps highly over-reduced. And this is a very quick and efficient way to reduce teeth. You're watching this video in real time with no editing at this point. You're just looking at me do this particular technique of depth plane reduction versus depth groove reduction, and in just a few minutes we're able to do an adequate reduction that will be extremely close to our ideal 1.5 millimeters of occlusal clearance. So we just wash off the tooth, and this is what we typically get. I think it's a nice way to start a crown prep. Now we're going to go ahead and perform exactly the same technique on the B plane. The B plane is the plane that's between the functional cusp bevel and the non-functional cusp. And this plane is reduced in exactly the same manner, and we're going to be able to judge how much we're reducing, just like we did on the lingual side. We're going to look at the remaining shelf of tooth that has not been reduced, and we're going to be able to measure exactly what that is as we go along. Yes, we need 1.5 millimeters of occlusal clearance when we're finished, but we're going to definitely have that after we are finished doing any little refining of this particular surface when we're done. The key here is, rather than having to remove all kinds of defects that were created by depth grooves, we're focusing more on the morphology of the reduction, the angles. We're making sure that cusp tips are in the right place, because we don't have any defects that are major to remove. We just have minor little discrepancies that we'll take care of when we finish up the occlusal reduction. We're now ready to start on the distal buccal and the distal cusp. And even though this tooth has a distal cusp, it's a rather small one. We're going to respect it and we're going to reduce it like it was a cusp, but it's going to be essentially, most of it will be removed when the axial walls are performed. One of the problems that some people have when we're doing any kind of reduction is that the burr will hit the opposite side of the reduction. So while you're working on this incline, the tip of the burr is damaging the incline that you just finished. And that's partly unavoidable. It does happen, but we can just be careful with knowing where the end of the burr is and sort of angling it so that it's not gouging into those lingual cusps. The 57 burr is definitely not the only burr you can use for this particular step. Some people utilize a cylindrical shaped diamond. Some people use a tapered diamond, and all of those are fine. We've used those at the center. I've used those personally on patients and on typodonts for many, many years. But we always come back to the 57010. It just provides us with the most consistent, smooth result, and we find this to be a very effective way to get our occlusal reduction. You notice how this reduction is taking a little bit longer than the first one because we're dealing with the fact that we're having to sort of harmonize the intersection between the reduction planes on one side of the tooth and the reduction planes on the other side of the tooth. So it takes a little bit longer. There's a little bit more fussing with this particular step. There's no need to bring the burr all the way over to the adjacent tooth. You're going to be removing that area with your interproximal reduction anyway, so it's best just to stay clear of it and avoid having a problem with a potential adjacent tooth damage problem. Now the burr is being slowed down just a little bit as this critical area between the buccal and the lingual are being formed. You notice I'm being just a little bit gentle, but at no point is the burr leaning down at a horizontal. It's always following the exact inclines of the tooth that we're reducing. We are not making it too steep, nor are we making it too flat. After we finish this C plane and B plane and this anatomical reduction technique that we're doing, we have not adequate occlusal clearance. In fact, there would be no occlusal clearance if you viewed it from the facial. Now we have to perform the functional cusp bevel. So I like to take the 56 burr and line it up so that it is parallel to the lingual cusps, and then use my finger rest to stabilize the burr, and then just bring the burr over to the facial side and start making the reduction. And over here, I'm just making a crescent shape, and I'm working it from mesial to distal in such a way that the cusp tips are now going to line up with the adjacent tooth cusp tips. And when we do this, we know that we have enough reduction. So this is all we're doing right now. We're just forming this sort of crescent-shaped functional cusp bevel, which is arguably the most important aspect of occlusal reduction, and unfortunately done by so many people as an afterthought, if at all, when they're doing crown preparations, and they'll make their crowns quite flat. So you can see here, if you were to take a look at the tips that we've just created on this particular preparation, they line up with the adjacent teeth, and that's how the tooth started. So we've just sort of brought it back to where it was before we began the preparation. I think at this point we're ready to move on to the axial reduction. You know, an axial reduction is really pretty simple on the facial and lingual if you line up the burr along the long axis of the tooth. And you'll notice that when the burr starts touching the tooth, it's going to hit the gingival third first. I mean, that is, after all, the height of contour on the facial, right? So we're going to hit that first, and this is where the primary retention is coming from. We are going to have to place a secondary plane about halfway up this wall on the facial to deal with contour. So I like to think of reduction of the axial as having two components. One component is for retention, and that would be that 2 millimeter, maybe 3 millimeter band of very nicely tapered axial walls circumferentially around the tooth. And then there's the upper portion, the more occlusal portion of the reduction. That more occlusal portion of the reduction would be dealing more with the contour or the aesthetic requirements of the case if you're doing an all ceramic preparation. But the key here is to follow nature. In the gingival area, we're going to go for retention. We're going to hold the burr as straight as we can along the long axis of the tooth. We're not going to worry about the finish line. We're not going to worry about the functional cusp bevel. We're just going to keep the burr following the long axis of the tooth and let the burr do the work. You notice that little shiny spot in the middle of the facial? Well, that's unprepared tooth structure. So that is an area where it is under-reduced, but that reduction will be done in a secondary plane rather than tipping the burr over or going too deep axially. That whole upper third of the facial wall, that occlusal third of the facial wall, will be reduced with a secondary plane. Sometimes people get the functional cusp bevel and the secondary plane confused, and they tend to blend together. So I'm going to show you a little bit from the side view in just a minute how we make sure that we distinguish between the primary plane and the secondary plane. One of the other things that I really like to try to do is get the burr to go as far interproximal as possible. You know, when it comes to reducing interproximal tooth structure, we really don't want that to be any harder than it needs to be. So let's go ahead and reduce as much as we can interproximally on both the buccal and the lingual first before we attempt interproximal. And we're not going to use this particular diamond for that purpose. We're going to use a very narrow diamond in the next step. So once we're pretty happy that we've got the one plane established on the facial and that it does have reasonable taper, we can see the walls reasonably well, they're a little bit tight. We're going to then go ahead and line the burr up with that gingival third and bring the burr over to the lingual, and then we're going to go ahead and start reducing the lingual. And notice how the tooth has a lean towards the tongue. In other words, it's leaning to follow the curve of Wilson. The tooth does not have a occlusal table that's parallel to the bench top. You have to think about tipping the burr a little bit lingually. While we're reducing the lingual, this will all be done in one plane from the gingival to the occlusal. We won't have two planes here. The whole prep started in the gingival, or in the middle third, not in the gingival third. So we have to reduce a significant amount of middle contour before we can get to the point where we have a single plane, but this is the only way to do it. You couldn't do it in any other way without creating an undercut. So we're going to go as far as we can interproximal, and I just have to emphasize the importance of keeping the burr, pushing it towards the interproximal as far as you can, so you end up with something like this, where you have these little extensions that look like little class 2 amalgam boxes that you're going to be removing with the needle-shaped burr. Let's take a look at the secondary plane on the facial. Notice how all of the teeth have this secondary plane, and the premolar and the molar. Whether this is a full gold crown, an all ceramic crown, or a PFM, this is one of the most critical steps to do. I own a dental laboratory, and I wish that everybody knew how important this was, because our lab technicians have a really hard time making aesthetic, strong ceramics when we're receiving preparations that don't have enough secondary plane reduction that follow the contour of the adjacent teeth. Remember, we're not going to lose a lot of retention because our retention is coming from that band around the gingival. The interproximal clearance, arguably one of the most difficult steps, can be best accomplished using a very thin burr. This is an 859-010. It is one of the most thin burrs that we've found. It's made by Brasseler. It's one of the burrs on our burr block, and we use this continuously for interproximal reduction. We don't use it to create margins, and we don't use it to create the taper of the axial wall. The sole purpose of this burr is to remove that contact area. That's what we're trying to accomplish here. So nothing is going to be particularly refined when we're done here. We're just trying to break contact in the buccal, lingual, and gingival areas. So we take the tip of the burr and we run it uphill. We're not taking the burr and trying to take the entire length of it through the interproximal, but rather we're taking it from a low point on the facial and riding uphill to get the contact area broken. And if you do it this way, it's a little bit easier than trying to get the whole burr through there at once. I have found that it's easy to nick the adjacent tooth, or to go too deep axially, or maybe even to over taper the axial wall. One of those three problems if you're worried too much about trying to get the entire burr through at once. So I'm finally getting the burr through all at one time there, but it took a while to get there because I had to kind of work my way from the top down. And now the distal, which is a much more difficult contact to break because in this particular typodont, it's a much taller contact, occlusal gingivally, but we're going to do the same thing. We're going to take the tip of the burr and we're going to work our way from the occlusal down to break the gingival contact, using the tip of the burr just to sort of feather through. This burr is so thin that if you break it out of the package by pushing the coarse end of it, the diamond particle end, through the little pressure packs it's sealed in, it'll bend the burr. So if you do get one of these burrs and you're buying it individually, you want to be careful to break it out of the sealed package by pushing the shank out of the package and not trying to push the tip out. It'll work a lot better for you. But you can see how we're leaving a little shell there of tooth structure as we're making our way through the interproximal area. And you're going to see in this preparation that we break contact. It's fine, but what we end up with is a pretty unattractive looking shoulder when we're finished. It doesn't look very good, but it sure does the job. That's the key here. Let's try to stay focused on one thing. Break the contact. Don't worry about the finish line. Don't concern yourself with the shape of the finish line. Just break the contact and keep it as close to tooth number 31 as you possibly can without hitting tooth number 31. And you know, on the distal here, it takes time. If you're working on a mannequin or in a dental chair, I like to have the patients turn a little bit away from me. I'm a right-handed operator, and I like to look straight at this preparation from the facial view. And you can see we've broken contact, but there's a J-shaped margin. There's kind of the shoulder. It's not very beautiful at this point. So just use the tip of the burr at this point to push down through and get the finish line down a little bit further gingivally. Extend it more gingivally so that you can have a chance of getting a burr through there in a subsequent step. This is not done. Remember, the purpose was to break contact. Well, mission accomplished. We're now ready to move on to making the axial wall more uniform. I like to call it axial reshaping, because we can put the burr in that we've been using, the 878K 012, the first burr we used for the axial. We're going to use the same burr. But this time we can now go all the way around the tooth and not have to worry about hitting the adjacent teeth. And we can have a nice uniform taper in that 1.5 to 2.5 millimeter band of retention, that retention zone that we need to have around this tooth circumferentially. You could use this burr to create a chamfer. It's going to give you a very, very small chamfer at the tip because the burr is really narrow at its tip, and it will only give you about a 0.3 millimeter chamfer depth. I think that's probably a little on the conservative side. It certainly makes temporaries very thin and very difficult to fabricate and not break on you. So I think it would be a good idea to go ahead and just work on the axial wall and get the finish line location in the right place and get these little corners rounded off. You see that little corner I'm working on in the mesiolingual? That's always a little rough spot. Those little areas between the proximals and the facial proximals and linguals are frequently kind of got these little irregularities, and that's really what we're working on. We're not really trying at this point to finesse the chamfer. We're trying to get the location in the right place. We're trying to take it a little bit more gingival, particularly on that distal where it's so close to tooth number 31. We want to maybe drop it down a little bit, but we're really not trying to worry about the form of that chamfer at this point. Some areas you may want to tip the burr a little bit to compensate for a tight wall. Some areas you want to upright the burr to compensate for an over-tapered situation. But don't fret. We are going to be able to make the preparation have the optimal taper and form after we get things at least somewhat more uniform around the tooth, looking a little bit more even as we around the tooth. So let's just clean this off really quick here and then take a look at where we're at. I mean, it's pretty good so far. It's not great. We've got no undercuts. We don't have uniform draw, so we have a few areas to work on, maybe on the facial a little bit, and we have perhaps looks a little bit like it has an internal undercut on the facial. And the lingual has more of a feather edge margin. That's definitely not going to fly. So those are some things that we're going to correct. And then we're going to move on to the fixing of the chamfer, which is one of my favorite steps, because this is where the prep really takes on that beautiful FGC look, you know, where you have that 60-degree declination of the chamfer all the way around, and you're just barely above the tissue level. That's what we do with this 8877009. And it's probably a good idea to just use half of the diameter of the burr, maybe slightly less. Half the diameter is probably going to be about what you're going to use in most cases. And then have the tip of the burr just skid off the edge of the finish line. Just run along there with the tip of the burr so that the edge of the burr is cutting the finish line and not the very end of the burr. And I want to make that point again. It's the side of this burr, not the tip of the burr, that is making that particular chamfer shape that we love. And this is really a true chamfer finish line. A lot of people are making chamfer margins today that are not really true chamfers. Chamfer means bevel. It doesn't mean shoulder. It means bevel. So what we're looking for in a chamfer margin is almost a bevel that is declining about 60 degrees off the axial wall. That 60 degrees will give us excellent closure of the margins. We understand the trigonometry that the steeper that is, the better closure we get. But anything more than 60 degrees is probably a little too much. Anything less isn't going to have nearly as profound of an effect on closing the margin. So we can use the burr, realizing of course that it is parallel. So you have to follow the walls that you've already established if you like that particular wall. If that wall was a little tight, you can still tip the burr and use it in that particular manner. But look at how smooth that makes the axial walls. It's really quite wonderful for creating smooth axial walls and chamfers of the appropriate dimension. We're now ready to go on to occlusal finishing bevels, and we've got a burr called a 7102. This is an awesome burr for many things, including finishing in composite restorations. It's just terrific. So we can run that burr along the occlusal lingual line angle, and we have to take off the sharp edge. You simply cannot deliver a crown impression or scan to a laboratory with a sharp edge. Those preparations are not going to be well tolerated by any laboratory or any dental school or any board exam for that matter. So we want to keep those edges there rounded. It makes the lab work a lot easier, and that burr really does the trick for us. And if you wanted to, you could use that burr to further smooth your preparation in other areas. But you can see that the prep is nearing completion. So perhaps a little refinement would help. And this is where you could use slow speeds or even hand instruments like this 44S off-angle chisel. This is amazing. This is one of the nicest hand instruments that dentistry has, and yet so few people know about it. I think this is one of those instruments that Dr. Richard Tucker introduced me to about 25, 30 years ago, and I found this to be just irreplaceable. It's one of those things, every restorative dentist should have one of these on their kit. They come in a mesial and a distal, so there's really a 44S and a 45S. You can use a secondary cutting edge, a primary cutting edge. You can remove sharp edges. You can refine shoulders. You can remove little undermine enamel. They're great, and you can just fuss with these for a little bit. And on this prep, I probably worked on the prep for a total of about 30 minutes to do the entire preparation, which is a long time. But we were able to accomplish a decent result just using the techniques I just showed you. Definitely not perfect, but I think that most of you would consider that to be a reasonable gold crown that would satisfy demands of a gold restoration. And the clearance we see here is excellent. It has a 1.5 in all areas. So we have a happy, successful procedure, and I hope that you enjoyed this. If you want more, check out our website at stevensondentalsolutions.com. We've got supplies, we've got more videos. Take care.